Hi guys, and welcome back to the Expand podcast. This is going to be kind of like a vlog style episode, and I'm going to talk about my experience with taking my birth control out. I've had the NEXPLANON, which was previously called the Implant for the last 9 years. And so I want to answer some questions about that. I want to show you guys the procedure if you're interested. If not, you can just skip through that part. I'm 32 years old and me and my husband have been together 5 years. We've been married for just over 2 years and we're ready to start the journey of having babies. And so I talked to him about this and he was okay with me sharing my journey. And so I'm going to just get super vulnerable and kind of just share the journey of the entire process. And this is where it starts with removing my birth control. So I'm super excited. I've been waiting for this moment for so long, but I just haven't been ready. And now it's time. I'm still currently in Japan. I leave here in 3 weeks, and Devron left about a week ago. And so I have a good couple weeks to just start getting my body ready for possibly getting pregnant. So far, I haven't really done anything to prepare besides one, I got back on my fitness routine because I know that I need to do that. And I've been slacking. And honestly, it's just good for me no matter what. And the second thing is started taking prenatals. And so, of course, that's really important because of folic acid and just a lot of vitamins and minerals that your body needs so that you don't have birth defects and things like that. I'm a labor and delivery nurse, and so I see a lot of women come through and having babies, and a lot of women are afraid in their 30s to have kids, but it's actually becoming a lot more common, and they say that at the age of 35, the risks increase, and they do, but it's kind of more like 39 than 35. You know what I mean? I'm really excited to start this journey and to share my experience with you guys, and I hope you enjoy this video. I can't wait to bring you guys along for this experience. So exciting. Today is a really special day for me because the long waiting is over. I'm finally taking my birth control out. And I was a little nervous to share that because I know people are going to be asking me, are you pregnant yet? Are you pregnant? And the situation that I'm in is that my husband and me are separated for a full month. And so we are ready, we want to start trying for babies, and we'll be separated for a month, and so it's perfect time for me to take my birth control out and then just give my body a full month to chill and let my hormones kind of regulate again. So I just went to 7-Eleven and got me a little shrimp and mayonnaise rice, and then I got my latte. Of course, you guys know I'm in love with 7-Eleven lattes. And it's always good. And so that's why I'm in uniform, because I'm just wrapping everything up in Japan. Right now, as I'm filming this, I have 23 days left, I believe. So this is what it looks like. It's just like rice, and then on the inside is going to be shrimp and mayonnaise, and then it's covered in seaweed. And I asked for soy sauce, and of course they didn't know what I was talking about, and then so I translated it in my translator, and they were still like, you can buy a bottle of soy sauce, but we can't give you soy sauce. And I'm like, come on. So good. It's so hot today. I'm sweating in this. It's not even that hot, but it just feels hot in the car. Oh my God, that was so good. I don't know why I haven't been eating those more. I'm tired of the hot case, the spicy chicken. And now I'm going to be on those for the next 3 weeks until I leave here. That was fire. All right, guys, we did it. It's out. It honestly was not as bad as I thought it would be. My previous experience getting this removed, because this is my third one, so I absolutely love the Implant-On, NEXPLANON, whatever you call it. It's amazing because once they insert it, it's good for 3 full years. And for me, I had no period for a year, and then after that year, my period started to come back, but it was really super light. And then by the 3rd year, I had a completely regular period again, and really like no issues or side effects with it. So this is what it looks like now. They go in, and what they'll do is they'll numb it with lidocaine. So you will get an injection with a needle, and it does sting a little bit. You just take a big deep breath and then let them do it. It feels like a bee sting. And then from there, what I did is I put my arm above my head like this, and then he took a scalpel and made an insertion. And it did take a while for him to get the rod. It's about like this long, the rod, and he had to get it up into that insertion that he made. And then once he got it through there, he was able to grab it with kind of like a pliers type tool and then kind of work the skin around it to get it out. But don't forget, I've had this for 4 years, so I actually let it expire for a full year. And because I didn't care if I was going to get pregnant, I was like, okay, I mean, we're not planning on having a baby yet. And from the research I did, it wasn't dangerous. I talked to my OBGYN, and she said not to worry about it. It probably won't cause any issues. There are risks that if you do get pregnant, then it can cause like an ectopic pregnancy. And so I was definitely careful, but I knew my periods were coming regularly, so I would have known if I didn't have a period. So there's that. Once he pulled the rod out, he showed it to me, and I was so relieved to have this thing out of my body. Like, I have just been waiting for this moment for so long to just take this birth control out. I arrived at my appointment at 11:25, and then I left there at 12:10. So it did take a little bit of time, but the reason why is because once they numb you with the lidocaine, it takes about 7 minutes for it to set up. And so they were kind of just setting up the table, getting everything set up while the lidocaine was like beginning to work. And then after that, it did take a while for him to be able to get that rod because it had gone pretty deep into my arm. After 3 years of it just like being in your body, like that's just naturally gonna happen. It's kind of just like embeds itself into your arm, and I could still feel it. So, but it took a little bit of digging, and then I would find it, I would feel it, and then you can kind of like push the skin up and you can see the edge of it. And so you can still feel it in your arm. If you ever cannot feel it in your arm, then that's not normal, and that would mean that it embedded itself like way too far into the muscle. The incision that they make is just so tiny, like just enough to be able to get that rod through. So just really, really, really little incision. And what happens is after they make that incision, they have to then take the rod and be able to pull it up through that incision. And that was what took the longest. Like once he was able to get that rod and pull it up through the incision that he made, things went a lot more smoothly. But I would say that part probably took like 20 minutes. He said this was definitely a moderate to difficult removal. He said it was a lot deeper than normal, and it was not superficial on the skin at all. So he said it definitely wasn't going to be an easy removal, so we knew that going into it. I want to show you guys the entire process because I kind of was filming during it so that I could see what was going on, because I'm definitely not one of those people who's like doesn't want to look. Like I was like, can I see? And I watched him make the incision and watched him, do some digging. And then the only thing I kind of missed because I was just chatting and trying to focus on breathing was the lidocaine injection. So everything else, I watched him do for the most part. And so if that's something that you're interested in seeing, then definitely stick around. And if not, then turn the video off here because it's a little not like too bad or anything. It's honestly will probably calm your nerves if you're thinking about getting an NEXPLANON. I think it would help to watch that part, but it's up to you. So turn the video off if that's not something that you want to see. This is the setup for a NEXPLANON removal. So you have the lidocaine, of course, and then you have that drawn up into a syringe with a needle. You have your Curalex, chlorhexidine if needed, Dermabond, which is basically like skin, it's like super glue for the skin, and some scissors. And of course, they'll pull out the other stuff that they need, like these clamps and the scalpel and things like that. They're going to clean the area, and then they are going to put on sterile gloves and put a drape over the area. Then they're going to really start feeling for the implant and make sure that they know exactly where it's at. At that point, then they will make an incision right where the implant is poking out. They will try to make the smallest incision possible, but they may have to go a little deeper depending on how long you've had the implant and how deep into your arm it actually is. During the procedure, I did not feel any of this. I felt maybe like a little bit of pressure or like tension, but no pain. Like when he made the incision, I did not feel him making the incision. And then it finally came out. It did take a little bit of digging because it was deep, deep within the arm. It was probably a good like 20 solid minutes of just like digging and trying to grab onto that implant and then pushing it through that previous incision that was made. And I was so happy to have it out. I want to do a quick little like Q&A about the NEXPLANON and the symptoms I had with it, as well as the removal process, like how did it go, and just cover all of that in this video. So the first thing I want to talk about is the removal. Was it painful? I will say it was uncomfortable, but not super painful. I had expected it to be much, much worse. So what they're gonna do is they're gonna inject you with lidocaine, and that's honestly the worst part. It feels like a bee sting. You take a big deep breath in, and you let your breath out slowly, and by the time that your breath is let out, it's done. And it's really not that bad at all. Once they inject you with the lidocaine, it takes a few minutes for your arm to become numb, and then they're gonna use a scalpel. They're gonna pull out the device, and you'll put your arm above your head like this, and really it's not that bad. It's really not that bad. It can take a while if it embeds into the arm, but overall it was a pretty simple and easy process, and you should be in and out of the doctor's office within like an hour. How does the NEXPLANON work? Does it secrete hormones? Like, how does it keep you from getting pregnant? It is a small rod that goes in your arm. It's about 1.6 inches, and it's like the size of a match. Very small in diameter, and you can feel it under the skin after the insertion. And what it does is it secretes a hormone called progestin. And that is the synthetic version of the natural hormone that our bodies produce called progesterone. Now, what this birth control does, it prevents you from getting pregnant through preventing you from ovulating. And so when you have this inserted into your arm, you will not release an egg for ovulation. And then another thing it does is it thickens the cervical mucus. And so during that time when you should be ovulating, it thickens the mucus to where the sperm can't get to the egg even if it wanted to. The NEXPLANON is highly, highly effective. I've had 3 different ones placed. The first one for 3 years, the second one for 3 years, and this one that I just got removed, I had it for 4 years total. It was expired for a year. And I still did not get pregnant, even when it was expired, and we were not using protection, nothing else. So it is highly, highly effective. They say that it's a 0.05% chance of getting pregnant. It's an even lower chance of getting pregnant than when a man gets a vasectomy. That's like a 0.15% chance of getting pregnant. And so I'm pretty sure it's the most highly effective birth control they have out there at all on the market. And if I'm wrong, then let me know in the comments. Does the NEXPLANON birth control or any hormonal birth control cause infertility? it does not. So they have done research and have shown that women with the NEXPLANON who have had it removed, and then women who did not have the NEXPLANON, so never had the NEXPLANON, was not on any kind of hormonal birth control, both parties got pregnant within 6 months. And so once you remove this device, you can get pregnant right away. So within 1 week, you can become pregnant. Now, should you wait a full cycle before you start actively trying? Like, yes, absolutely, because it does take some time to flush these hormones out of your body. But they actually tested the blood to see if the hormones were still lingering around, and it was shown that within 1 week, those hormones were non-detectable in a woman's system. Does the NEXPLANON cause weight gain? Yes. I think every single birth control, it doesn't matter what it is, anything that's messing with your hormones, and especially a birth control that's secreting progesterone or progestin, which is a synthetic version of progesterone, it's going to cause some type of weight gain. So in research, it showed that within 1 year, the average weight gain is 5 pounds. So that's really when you have to look deep within and kind of weigh the pros and cons and get your priorities straight, right? Because if you don't want to get pregnant, it's much better to maybe have 5 pounds of weight gain in a year and a little bit of water retention versus having an unwanted pregnancy. And then lifestyle changes, right? So maybe you should be a little bit more careful if you get the NEXPLANON, to just be aware that yes, it may cause a little bit of weight gain, it may mess with your hormones, and so maybe you just have to take, eating healthy and exercising and just considering your lifestyle a little more than before when you could be a little more careless. Does the NEXPLANON cause abnormal bleeding? For some women, it absolutely does, and some women actually have it removed because of that. It really just depends on your body. My personal experience is that it did not, it did cause abnormal bleeding, but not in a way that you would think. And so what happened for me is that the first year I had no period whatsoever. The second year I was having abnormal periods, so maybe a period every 3 months, and then 1 month I would have 2 periods, and I had a little bit of spotting in between. And then by the third, am I saying month? I meant the first year, no period. Second year, abnormal periods. Then the third year is when I started to regulate. And then my body went back into how it always was before I started birth control. And I was having regular periods. And so I was using the Flow app. I was tracking my periods, and, every single cycle was spot on. And so really, really regular and light periods the third year. And I also had this in an extra year, 4 years. And so that fourth year was the same way. Just super regular periods, sometimes 1 day of heavy bleeding, sometimes 4 days of light bleeding, but never more than 4 days of bleeding, and super regular periods. How long does it take to get pregnant after removing the NEXPLANON? I personally don't know exactly how long it takes. I just took mine out, but I'll keep you guys updated. They say that it takes a week for you to flush those hormones out of your body. You can get pregnant on NEXPLANON's site. It says within 7 days. Within 7 days, they said use a backup contraceptive because you can get pregnant. And some women said, I did a lot of research, they said they got pregnant within 3 months. Some women said a year, 6 months. So it really just depends on the woman. But you can get pregnant once these hormones are out of your system. And that can be within 1 week, or generally they say that women will ovulate within 3 to 4 weeks from taking the NEXPLANON out. And so that's something to think about, that you could be ovulating 3 to 4 weeks after the removal of your NEXPLANON, and you could get pregnant right away. What are the most common side effects of the NEXPLANON, and why do women most commonly have it removed? We'll tackle the second question first. So the most common reason why women have it removed is because of abnormal bleeding. And so there are a lot of women who experience abnormal bleeding. I was so lucky that I was not one of them. I think that this birth control does work really well for women who don't have like super heavy periods. I think if you have a more heavy cycle, then you may have a higher chance of abnormal bleeding. After reading some of the research, the number one most common symptom that people have from NEXPLANON is headache. And I will say that I do experience headaches, I do experience migraines, but this was happening even before I had the NEXPLANON inserted, and so I don't necessarily know that it was caused by that. I mean, I was 15 when I started taking birth control, and so maybe my headaches are from birth control. I guess we'll find out now that I've taken this out, and we'll see if my headaches resolve. And I'm just going to read you some other symptoms that some women experience with the insertion of the NEXPLANON, and that's inflammation of the vagina or vaginitis, of course, weight gain, which we already talked about, acne, breast pain, abdominal pain, sore throat, whitish yellow discharge from the vagina, flu-like symptoms, and dizziness. And then a lot of people experience irregular bleeding. It says that 34% of people said they had less frequent bleeding, and about 22% said their period went away completely, which was my case. The first year I had no period at all. And it says that some people find that their period gets lighter or goes away. From doing some research, I saw that some women were saying that they developed anxiety, they developed depression, they developed muscle aches and joint pain. Some women said that a lot of women actually said that they had absolutely no sex drive and very low libido. There were women saying that they just don't feel like themselves, and then within a month being off of the birth control, like they just felt like so much more in tune with their body and they felt like themselves again, which is really interesting because I think that when we alter our body as women with any kind of hormone, like it's going to cause an imbalance, and it doesn't matter how many years that we're on it. Obviously, the more natural, the better. And so not being on a birth control and not constantly putting hormones in your body is always going to be better for your body. And of course, you're going to feel more like yourself and more regulated and just like more in tune with yourself and with your emotions and with your body. But like with anything, like we have to weigh the pros and the cons of that. And obviously the pro of that is that if we're not ready to have a baby, then we need to be on some type of birth control if we're sexually active, because let's just be honest, like pulling out it's not the answer. And I think as women, like we need to be more responsible and making sure that we're taking care of our bodies and that we're not bringing unwanted life into this world, because there's just too many kids who are born into families that are not wanted, and that it's just not fair. And I know there's always adoption and things like that, but we have a way of preventing this and just being responsible and taking responsibility for our actions. And unfortunately, like one of those things is that as young women who are sexually active, like we need to be on birth control unless there's another way. Or even with condoms, like it can break. That's how my mom got pregnant with me. The condom broke. She told me that. I know it's horrible, but it's like it happens. So I mean, I understand like birth control sucks. Like I don't want to be on it either, and like I'm so happy that I finally was able to remove my birth control. And but you know, we do have to think about the pros and the cons of birth control versus getting pregnant. Other very, very serious side effects of the NEXPLANON are ectopic pregnancy and blood clots. And with ectopic pregnancy, it's where the egg and a sperm implant, usually like in the fallopian tube, and then it can start growing over time, and it can end up bursting your fallopian tube and, you know, causing you to possibly have that fallopian tube or ovary removed, which can decrease fertility. I will tell you that I have had the NEXPLANON in my body for basically 10 years, and I have experienced minimal side effects. I mean, overall, I wouldn't have kept getting it. You know, I had the first one for 3 years, had it removed, had it replaced, and I wouldn't have continued having it replaced if I had such serious side effects that, you know, I was concerned. And I've tried so many different birth controls. I've been on the pill, I've been on the NuvaRing, I've gotten the Depo shot, I actually had the IUD inserted, and I've also had, of course, the NEXPLANON, and by far the NEXPLANON has been my favorite out of all of the birth controls, and I've pretty much tried it all besides the patch. I think the patch is just about the only thing that I haven't tried. So after trying like a million different birth controls, and I will say I don't know if I said that in this video or if it was in another video, but I've been on birth control since I was 15 years old. So, and now I'm 32. So after being on birth control for over 15 years, and having my NEXPLANON removed, let's see how long it takes me to get pregnant. I'm definitely going to wait a full cycle and, you know, not try to get pregnant at all for at least a month, and then we'll see what happens after that. So if you want to follow along on my journey, then just hit that subscribe button. If you can, I would appreciate it so much if you like this video, and I always love connecting with you guys. I answer all of my comments, and so please, if you have anything to share, if this video was relatable to you in any way, or if you want to share your personal experience with birth control or anything regarding like any of these topics, especially if you're in your 30s trying to get pregnant, or if you have an experience where you got pregnant, how long did it take you to get pregnant after your NEXPLANON removal or after discontinuing any birth control that you are on? If you want to connect on socials, all of my links are below. I'm on all of the platforms. I would love to hear from you. I would love to connect with you. So please get on and give me a follow. All right, guys. I hope you enjoyed this video, and I will see you in the next video. Bye.